Baby boomers are aging, and now there's an alarming new study about the so-called silver tsunami. It finds more and more people over the age of 50 are ending up homeless.
Over 800,000 Americans now live in RVs because they have nowhere else to go, and a growing share of them are seniors. As housing collapses and enforcement tightens, elderly Americans are being pushed out, moved along, and quietly erased from the system. Adults aged 55 and older represent the fastest-growing segment of America's homeless population. Federal data shows over 20% of unsheltered people are seniors, though researchers believe the actual number is much higher due to widespread undercounting. Many older adults avoid traditional shelters and instead live in vehicles or RVs, making them invisible in official statistics. Housing policy analysts project that senior homelessness will triple by 2030 if current trends continue unchecked. The median age of homeless individuals has shifted dramatically. In 1990, it was 35 years old. Today, it exceeds 50. This change reflects an entire generation aging into homelessness after experiencing decades of wage stagnation, skyrocketing housing costs, and minimal retirement savings. Nearly 50% of Americans over 55 have zero retirement savings, while Social Security provides only about $1,900 monthly on average, far below median rent across most states. Medical expenses accelerate financial decline. Adults over 65 spend 3 times more on health care than working-age adults, even with Medicare coverage. A single hospitalization can eliminate remaining savings and trigger eviction. Once homeless, seniors struggle to secure new housing due to fixed incomes, mobility limitations, and extremely long waiting lists. In many metropolitan areas, Section 8 housing voucher waitlists stretch 5 to 10 years, effectively excluding seniors from assistance. This isn't a temporary spike in homelessness. It's a fundamental demographic shift. The aging baby boomer generation combined with severe housing scarcity is structurally increasing senior homelessness every year. Most homeless seniors didn't experience lifelong poverty. They became homeless when a single financial emergency collided with a fixed income. Social Security replaces only about 40% of pre-retirement income, while housing costs have increased over 60% since 2000. This mismatch creates impossible financial mathematics. Housing experts define cost-burdened as spending more than 30% of income on housing. Most seniors now spend 50 to 70%, leaving insufficient funds for food, medication, or utilities. Property taxes and insurance make matters worse. Seniors who once owned homes outright face displacement from tax increases, homeowner association fee hikes, or insurance cancellations, especially in states experiencing climate-related risks. Reverse mortgages may delay foreclosure, but eliminate equity safety nets. Once sold or foreclosed, re-entering the rental market becomes nearly impossible. Inflation compounds everything. Between 2021 and 2024, food prices rose over 25%, while Social Security cost of living adjustments lagged behind real senior expenses. Prescription costs regularly exceed $300 to $600 monthly for chronic conditions, even with Medicare Part D coverage. This isn't financial mismanagement, it's arithmetic failure. Fixed incomes cannot absorb variable costs. When rent increases faster than benefits, homelessness becomes mathematically inevitable, not from poor behavior, but from impossible economics. Seniors aren't failing to budget properly. The system itself has become unaffordable for people living on retirement income designed for an economy that no longer exists. For many seniors, an RV isn't a lifestyle choice. It's the final barrier between shelter and sleeping on sidewalks. Used RV prices surged during the housing crisis, but they remain cheaper than rent in many regions. Seniors often liquidate remaining savings to purchase $8,000 to $25,000 RVs, believing they can survive on parking fees, fuel, and minimal utilities. However, RV living introduces dangerous new risks. Mechanical failure can instantly render a senior completely homeless overnight. Unlike apartments, RVs offer zero legal tenant protections. A single tow notice can erase someone's entire living space. Existing health conditions make RV survival particularly dangerous. Seniors face higher risk of hypothermia below 50 degrees Celsius and heat stroke above 90 degrees Celsius, both common inside poorly insulated vehicles. Carbon monoxide poisoning from heaters and generators is a recurring cause of death. Many seniors lack access to electricity for critical medical devices like oxygen concentrators or CPAP machines. Sanitation creates another major hazard. Without dump station access or running water, infections and dehydration become commonplace. Emergency responders report that seniors living in vehicles are twice as likely to die during extreme weather events compared to housed seniors. The RV isn't providing safety. It's merely delaying the inevitable. Once the RV is lost, broken down, or towed away, seniors transition immediately to sidewalk homelessness, where mortality rates spike dramatically within the first year of street living. Official homelessness counts drastically understate senior suffering because they fail to capture vehicle dwellers, couch surfers, and informal RV communities. Point-in-time counts occur once yearly, often during winter, and rely on visual identification. Seniors in RVs parked legally or semi-legally are excluded entirely from these counts. Researchers estimate that for every visibly homeless senior counted, there are 2 to 3 more living in vehicles or temporary arrangements. This hidden population avoids shelters due to safety concerns, mobility issues, or lack of medical accommodations. Consequently, their deaths are rarely recorded as homelessness-related. Medical examiners typically list causes such as heart failure, dehydration, or infection, without noting housing status. This obscures systemic responsibility. Studies comparing housed and unhoused seniors show mortality rates 3 to 5 times higher among the homeless, with average life expectancy reduced by 10 to 15 years. Isolation proves lethal. Seniors without family or community support often die unnoticed. First responders routinely discover deceased individuals in vehicles days or weeks after death. These deaths rarely make headlines and are excluded from policy debates. Because they remain unseen, resources are misallocated. Cities design programs based on flawed counts, underfunding senior-specific housing and medical outreach. The crisis appears smaller than reality, allowing it to grow unchecked. Hidden homelessness isn't a statistical error. It's a deadly blind spot that quietly increases senior deaths every year, while policymakers remain unaware of the crisis's true scale. Across America, cities are enforcing stricter bans on vehicle dwelling, overnight parking, and RV habitation. These policies disproportionately affect seniors who cannot relocate easily or comply with constant movement orders. Enforcement is framed as public safety but operates as mobile eviction. Each tow costs $1,000 to $3,000, far beyond senior financial means. Once towed, RVs are often destroyed or auctioned within weeks. Seniors lose not only shelter, but medications, documents, mobility aids, and personal records. Recovery becomes impossible. Frequent displacement worsens health outcomes significantly. Medical studies show that forced moves increase hospitalization rates by 40 to 60% among older adults. Disrupted medication schedules lead to strokes, heart attacks, and diabetic crises. Missed medical appointments result in lost benefits and disrupted care continuity. Cities argue enforcement encourages shelter use, but shelter capacity remains insufficient. Many shelters refuse individuals with medical needs, pets, or mobility devices. Seniors are often turned away or forced into unsafe congregate environments where infection risk runs high. Data from municipalities shows that enforcement doesn't reduce homelessness, it increases churn. Seniors are pushed farther from services, farther from clinics, and deeper into isolation. Mortality rises while visible homelessness temporarily declines from public view. This isn't neutral policy. It actively converts precarious survival into fatal exposure, especially for seniors whose aging bodies cannot withstand constant displacement. Cities are essentially criminalizing the act of being elderly and homeless simultaneously. America's safety net wasn't designed for mass senior homelessness. Social Security, Medicare, and housing assistance function independently, leaving critical gaps. Housing vouchers reach only 1 in 4 eligible seniors due to funding limitations. The rest wait years, often dying before assistance arrives. Medicare covers medical treatment but not housing, utilities, or long-term care coordination. Medicaid eligibility varies by state, leaving many seniors uninsured or underinsured. Navigating applications requires internet access, documentation, and cognitive capacity, barriers many homeless seniors cannot overcome. Shelters are mismatched to senior needs. Most lack medical staff, refrigeration for medications, or ADA-compliant facilities. Congregate shelters increase exposure to influenza, COVID-19, and pneumonia, leading causes of death among homeless seniors. Federal affordable housing construction has declined dramatically. America builds less than half the housing units needed annually, while senior demand continues rising. Meanwhile, nursing homes require asset depletion, forcing seniors to become officially poor before receiving care. The result is a system that responds after collapse, not before. By the time seniors qualify for help, they are already medically fragile and housing excluded. This isn't individual failure, it's systemic design failure, one that converts aging into homelessness and homelessness into early death. The programs that exist were built for different demographics and different economic conditions. They cannot address today's crisis of seniors aging into street homelessness at unprecedented rates. Climate extremes have become a major driver of senior deaths among the unhoused. Older adults are physiologically less able to regulate body temperature, making heat waves and cold snaps especially lethal. Medical data shows adults over 65 are 4 times more likely to die during heat events than younger populations. RVs provide minimal insulation. Interior temperatures can exceed 120 degrees in summer and drop near freezing during winter. Seniors living in vehicles lack consistent access to air conditioning, heating, or power hookups. Running generators increases carbon monoxide risk, while idling engines consume fuel seniors often cannot afford. Between 2020 and 2024, heat-related deaths in America rose by over 50%, with disproportionate numbers involving older adults without stable housing. Cold exposure is equally deadly. Hypothermia can occur indoors at temperatures as high as 50 to 60 degrees, especially for seniors with low body fat or circulation issues. Emergency cooling and warming centers exist, but enforcement policies often force seniors to move away from urban areas where these services are located. Transportation barriers, mobility impairments, and fear of losing their RV prevent many from accessing help. Weather is no longer an occasional risk, it's constant pressure. Each heat wave, wildfire evacuation, flood, or winter storm compounds physical stress. For seniors living in RVs, extreme weather shortens survival timelines dramatically, turning temporary shelter into a recurring medical emergency that many bodies simply cannot endure repeatedly. Most homeless seniors are medically fragile before losing housing. Over 70% have at least one chronic illness, such as heart disease, diabetes, COPD, or kidney failure. Stable housing is a critical component of managing these conditions. Without it, health declines accelerate rapidly. Medication storage becomes impossible. Insulin, inhalers, and heart medications require temperature control. Missed doses can trigger hospitalization within days. Seniors experiencing homelessness are 3 times more likely to visit emergency rooms, yet far less likely to receive follow-up care. Mobility limitations compound the problem significantly. Many seniors rely on walkers, wheelchairs, or prosthetics. Uneven terrain, lack of bathrooms, and forced vehicle relocation increase fall risk. Falls are the leading cause of injury-related death for adults over 65. Mental health deteriorates as well. Cognitive decline, depression, and anxiety worsen under chronic stress. Studies show dementia symptoms accelerate significantly in homeless environments. Once cognitive function declines, navigating benefits, appointments, and compliance becomes nearly impossible. Healthcare systems aren't structured for this reality. Clinics discharge seniors back to vehicles after treatment, creating a revolving door. Without housing, recovery fails repeatedly. Medical fragility doesn't cause homelessness. Homelessness magnifies fragility until survival becomes unlikely. The combination of chronic illness and unstable housing creates a downward spiral. Each health crisis makes housing harder to maintain, and each housing disruption worsens health conditions. This cycle accelerates until seniors become too sick to recover. Loneliness isn't just emotional, it's medically lethal. Seniors experiencing homelessness often lack family, partners, or community connections. Social isolation increases mortality risk by up to 30%, comparable to smoking or obesity as a health hazard. RV-dwelling seniors are frequently invisible. They avoid attention to prevent citations or harassment. This isolation means fewer welfare checks, fewer emergency interventions, and delayed discovery when health crises occur. Many deaths are completely unwitnessed. Isolation also blocks advocacy. Seniors without social networks struggle to navigate bureaucracy. Missed mail, expired identification, and lost phones can sever access to benefits entirely. Once disconnected, re-entry is rare. Research shows seniors with consistent social contact are far more likely to survive homelessness and transition back to housing. Without it, decline accelerates. Isolation becomes cumulative. Each day without contact increases risk exponentially. In this crisis, deaths aren't always sudden. They're gradual disappearances, people slipping through systems with no one left to notice their absence. The elderly man who dies in his RV in a Walmart parking lot may go undiscovered for weeks. The woman who stops showing up at the food bank simply vanishes from community awareness. Without social ties, there's no one to sound the alarm when someone needs help, and no one to mourn when they're gone. Social isolation transforms homelessness from a housing crisis into a death sentence. Once concentrated on the West Coast, senior RV homelessness is now expanding into the Midwest, South, and Northeast. Rising rents, insurance withdrawals, and property taxes are pushing seniors out of housing in states previously considered affordable. States like Arizona, Texas, Florida, Tennessee, and Ohio report rapid growth in vehicle homelessness among older adults. Warmer climates attract displaced seniors seeking survivable conditions, creating overcrowding and stricter enforcement responses. Rural areas are not immune. Seniors pushed out of cities migrate to smaller towns lacking services, hospitals, or housing programs. Emergency response times increase, and mortality rises accordingly. This is no longer a regional issue. It's a national pattern driven by housing scarcity and aging demographics. As the population over 65 grows by millions each year, pressure will intensify across all regions. The geography of senior homelessness is shifting rapidly. Communities that never dealt with visible RV encampments are now seeing dozens or hundreds of seniors parking in commercial areas, rest stops, and public lands. Local governments lack experience managing this crisis and often respond with enforcement rather than services. Even traditionally affordable states are becoming unaffordable for seniors on fixed incomes. The problem is metastasizing outward from expensive coastal cities into America's heartland. No community is prepared for the scale of what's coming. As more seniors lose housing, RVs will become even more common as emergency shelter nationwide. Allowing seniors to die while homeless is not only a moral failure, it's economically irrational. Emergency medical care for unhoused seniors costs far more than housing interventions. One hospitalization can exceed $20,000, while supportive housing costs less annually. Studies show that providing stable housing to medically vulnerable seniors reduces healthcare spending by up to 40%. Yet funding remains fragmented and reactive rather than preventive. Every senior death represents preventable loss. These are people who worked, paid taxes, raised families, and contributed to society for decades. Their deaths aren't inevitable. They're policy outcomes resulting from choices about resource allocation. Without intervention, senior homelessness will continue rising and street deaths will increase proportionally. The cost will be paid in lives, strained hospitals, and moral credibility as a nation. This crisis is not coming. It's already here, claiming lives daily across America. The economic argument alone should compel action. Society pays for senior homelessness one way or another, either through preventive housing or through expensive emergency interventions, hospitalizations, and premature deaths. The current approach is the most expensive option while producing the worst outcomes. Beyond economics, there's a fundamental question about what kind of society allows its elderly to freeze, overheat, or die from treatable conditions in parking lots after lifetimes of work and contribution. Inaction is a choice with consequences measured in human lives. Emergency shelters are often presented as the solution, but for seniors, they frequently increase risk instead of reducing it. Most shelters are designed for short-term, able-bodied adults, not elderly individuals with chronic illnesses, mobility limitations, or medical equipment. Many shelters lack ADA-compliant bathrooms, lower bunks, or quiet medical spaces, making them unsafe for seniors. Rules also exclude large numbers of older adults. Curfews conflict with medical schedules. Pets, often a senior's only companion, are banned. Couples are separated. Medical oxygen, mobility scooters, or refrigerated medications are frequently prohibited due to liability concerns. Congregate shelters significantly raise infection risk. Seniors are far more vulnerable to influenza, pneumonia, COVID-19, and norovirus, all of which spread rapidly in crowded indoor environments. During outbreaks, seniors are often advised by doctors to avoid shelters entirely, leaving RVs or streets as the only option. Length of stay is another problem. Shelters typically limit stays to 30 to 90 days, far shorter than the years-long wait for affordable housing. Seniors cycle back to homelessness repeatedly, each time weaker than before. For many older adults, shelters aren't refuge. They're a last resort, actively avoided. When policymakers count shelter beds as solutions, they ignore the medical reality facing aging bodies. Shelters solve homelessness for some populations, but often fail seniors entirely. Accessing assistance requires navigating complex systems that assume digital access, cognitive clarity, and physical stability, conditions many homeless seniors lack. Applications for housing, healthcare, and benefits often require online portals, scanned documents, and repeated verification steps. Lost identification is catastrophic. Without ID, seniors cannot access Social Security, Medicare, or housing programs. Replacing documents can take months, during which benefits are frozen. Mailing addresses are required, yet many seniors living in RVs lack stable mail access. Cognitive decline worsens the barrier significantly. Mild dementia or memory loss, common after age 65, makes it difficult to track appointments, deadlines, or paperwork. Missed steps result in automatic disqualification from programs. Caseworkers are overloaded. In many cities, one worker manages 50 to 100 clients, making personalized senior support impossible. Follow-ups fall through, applications expire, and seniors drop out of the system silently. The system doesn't adapt to seniors. It waits for perfect compliance. Those who cannot keep up are labeled non-compliant rather than vulnerable. Bureaucracy becomes a filter, helping only those strong enough to navigate it, while excluding those most at risk of dying. Instead of meeting seniors where they are, systems demand seniors meet impossible standards. The most vulnerable, those with cognitive decline, lost documents, or no internet access, are systematically screened out. The people who most desperately need help are the least able to access it. Older women represent a rapidly growing share of the homeless senior population. They typically earn less over a lifetime, receive smaller Social Security checks, and live longer, stretching limited resources further. Widowhood is a major trigger. After a spouse's death, household income can drop by 30 to 50% overnight. Women are also more likely to have interrupted work histories due to caregiving responsibilities, reducing retirement savings significantly. Nearly 2/3 of elderly women rely on Social Security for the majority of their income. Homelessness is especially dangerous for women. Risk of assault, theft, and exploitation is significantly higher. Many women choose RVs or vehicles specifically to avoid shelters where abuse is common. This keeps them hidden and uncounted in official statistics. Health consequences escalate quickly for homeless women. Osteoporosis, arthritis, and autoimmune disorders are more prevalent in older women, making cold exposure and falls more dangerous. Limited access to gynecological care compounds health risks. As rents rise, elderly women are being displaced at accelerating rates. This isn't a fringe issue. It's a gendered crisis unfolding quietly, with women aging into homelessness faster than housing systems can respond. The feminization of senior homelessness reflects lifetime economic inequalities compounded by aging. Women who earned less, saved less, and face higher healthcare costs are disproportionately vulnerable when housing becomes unaffordable. Their crisis often remains invisible until it becomes fatal. Senior homelessness doesn't occur in isolation. It destabilizes families, healthcare systems, and entire communities. Adult children often lack the space or income to absorb aging parents, especially amid high housing costs and multi-generation crowding pressures. When seniors lose housing, responsibility shifts to emergency services. Ambulance calls, emergency room visits, and hospital stays surge dramatically. Hospitals become de facto shelters, discharging patients back to the street once medically stabilized. Communities absorb the cost through strained public services, increased policing, and overwhelmed clinics. Meanwhile, younger generations watch the collapse of the retirement promise in real time, eroding trust in institutions and future planning. The message is clear: working your entire life no longer guarantees safety in old age. This perception changes behavior across generations, increasing financial fear, hoarding, and disengagement from long-term planning. Senior homelessness isn't just a crisis of today's elderly. It's a warning signal to everyone behind them in the age pipeline. When younger people watch their parents or grandparents become homeless after decades of work, it fundamentally changes their understanding of social contracts. The promise that hard work and saving lead to secure retirement has been broken. This creates ripple effects through family structures, community stability, and generational trust. The crisis of today's seniors becomes tomorrow's widespread social instability as trust collapses. Without intervention, senior homelessness will accelerate sharply through the late 2020s. The population over 65 is expanding faster than housing supply, while affordability continues eroding. Each year, more seniors will cross the threshold from housed to unhoused. Deaths will rise quietly through exposure, untreated illness, and isolation. These deaths will remain underreported, categorized as natural causes rather than systemic failure. RV living will become less viable as enforcement tightens and parking disappears. Seniors will lose their last buffer and transition directly to street homelessness, where survival timelines shorten dramatically. This trajectory isn't hypothetical. It's already unfolding across America. The only variable is scale and speed. Without structural change, aging in America will increasingly mean aging without shelter and dying without notice or intervention. The next decade will determine whether senior homelessness becomes normalized or addressed. Current trends point toward normalization. As more seniors lose housing, society may simply adjust expectations downward, accepting that a certain percentage of elderly citizens will die in vehicles or on streets. The alternative requires massive investment in affordable senior housing, healthcare integration, and income support. Without these changes, the crisis will continue expanding until it touches nearly every family in America. The question isn't whether this crisis will worsen, but whether society chooses to intervene before the death toll becomes undeniable. This is what a system looks like when it lets its elders disappear. And this crisis doesn't stop here, because in our next video, we expose which states are accelerating senior RV evictions right now. Watch it next and tell us in the comments, should this be happening in America at all?